I am so excited because we are live, and I'm going to have you guys, if you would, just some technical stuff. I'm going to have you guys that are going to be sharing from your mobile devices or your tablets. Make sure that you turn your volume down so that we don't get any feedback while we are live. I am going to do the same thing because I am notorious for going into a space and still not. All right. And so I have confirmed that we are live, and let's go ahead and dive in. My name is Tony Mcneil. Everybody can. Oh, and go ahead and mute yourselves so you don't feel bad that I muted you. So my name is Tony Mcneil. I am a community organizer with Faith in the Valley. I am the founder of Concrete Development, where I work with individuals that have been directly impacted by systemic oppression, Black and Brown communities. And I am also one of the founding leaders of the Concrete team, which is the same population, a whole bunch of folks that know how to influence folks in their community and organize for change within their communities. And so today we're going to be having a live conversation about COVID. I'm smiling because I'm excited because I get to hang with my folks. These is like my folks, and we just go chop it up. We gonna talk for real about COVID and just what's going on. So the conversation is centered around COVID WTF. You know, I ain't gonna scare nobody by saying what WTF actually means. But what we did was transition it to mean what's the facts. So we're going to have this COVID conversation today. And my partner in crime today is Brother Chris Cannon. I know he mad because I said brother, but you know.
Nah, it's all good. How you doing? My name is Chris Cannon. I'm a program manager at Public Health Advocates. I'm really excited to just, listen in and be a part of this conversation about COVID. I think it's a real hot topic and something we need to discuss within the Black community for sure. So I appreciate the time.
All right. And so what we're going to do is I also am honored to be in the presence of Miss Mary David, who is another partner in crime. And so, Mary, if you could introduce yourself.
Yes. Hey, everyone. Mary Davis here. I'm an outreach specialist with Public Health Advocates. We are excited to be with you guys, and we're interested in what you guys have to say, what the facts are with COVID. Thank you, Elder Tony, for having me today, too.
Oh, thank you for taking the time out and tapping in. So we also have some folks from the Concrete team. And I'm just putting all of y'all from the Concrete team at this point. So I'm going to start off by popcorning it around. James, you want to introduce yourself?
Yeah, unmute real quick.
You unmuted.
Oh, okay, my bad. All right, I'm James, and I'm also a leader in the Concrete team, and just joy to be here right now and to see all the new faces, and hopefully get to meet all the new faces at some time kind of soon in face, other than just on this screen though, but ready to indulge into what we have to talk about with this COVID situation and this new strand and everything that's going on, and see what everybody has to offer, as well as picking brains to see what we need to do on our half to try to push forward to get things done and get things implemented into what's going on.
I super appreciate you, James, for tapping in this evening. So who do you want to go next, James?
Let's go with the young gun that I just met last night. Is he on here?
That's Nick.
Yeah, come on, Nick.
Nick, I see the top of your head, which, you know, it looks
good.
Introduce yourself, Nick.
I'm Nick. I'm an IYT mentor. I am a college student, and that's about it.
Nick, can you lower your screen some so that we can actually see your face? There you go. Ooh, I see him. And Julian, introduce yourself. Say it with your chest, Julian.
My name is Julian Johnson. I'm just a local student like Nick. I'm college student, 22. I'm glad to be here. I appreciate y'all having this conversation.
So we have a couple of folks that'll be popping in and out through the course of this conversation, but tonight we are going to talk about COVID. And so, man, the first thing I guess that I want to do is I just want to put it out there. Any of y'all scared?
Oh yeah.
You said yeah?
Scared of COVID or scared of the vaccine? Scared of which
Oh
one?
no, just scared. Period. I'm just throwing it out there. At this point, we don't talk about some stuff, but I'm like, is anybody scared? I know ain't nobody no punk on the call. You know what I'm saying? But is anybody just scared? You know, like it's COVID got anybody else but me nervous.
I'm scared for my family. I am. I'm scared. You know, it's back to school. Kids are going in and out. They're participating in sports. So I will definitely say that it makes me a little nervous.
All right. Anybody else? Just COVID got anybody else feeling a little wobbly, a little nervous?
More scared because of just how everybody is. You know, it's like a civil war almost kind of going on. So in that fact, you know, kind of scared to see the outcome of all this play out, right? You know what I'm saying? Are you going to lose friends, and not by death, but just difference of opinions, right? You know, are you going to fall out with people and things like that? So scared of that sense of the outcome of the aftermath of COVID.
Yeah. What about you, James? I heard you say, well, I don't want to put no words in your mouth, but I think that you was like, or something.
Oh yeah. I was lightweight, like piggybacking off of what the young lady has said up there. It's more so the nervous situation and knowing that this is real, and so many not taking it serious, you know, and even those that have taken it serious, like myself, they ended up being a victim of it. So therefore, it's a real scary situation. It's touchy, like she said. Kids going back to school, like my biggest fear is like my grandkids and all that, and not having that fighting power that we so much have as being grown and being able to this, that, and other. And, you know, as kids, some of them younger, not knowing how to tell what hurts, not knowing how to do this and do that. So, yeah, it's a fearful situation, especially when people not taking it serious. But, you know, at the same time, you still got to live life.
What about you, Fabian? COVID got you scared or uncomfortable, a little bit nervous?
I did, and most definitely did. However, though, I was my partner here in the family. We were taking care of one, you know, of each other. One, like being out there, you know, we were quarantining ourselves, you know, using the mask. And as soon as the vaccine came around, we were in a hurry trying to get it. You know, for the same reason, because you know, we were scared of it. It was real, right? And again, my partner is you know, she works in the medical field, so she was witnessing a lot of reality things. So,
oh wow,
yeah.
I know that. So I see Vila, Miss Vila. Can you do me a favor? Thank you for joining us. Can you introduce yourself, Miss Vila?
I'm sorry, I keep getting disconnected. My name is Vila Mcneil. I'm a registered nurse in various areas of California right now in San Joaquin County for the prison system as well as in the Bay Area. And I'm an ER nurse / trauma nurse. Essentially, COVID nurse.
Oh, wow. So prior to COVID, were you just, you know, in a sense that, well, I don't want to say just, but you were the ER trauma nurse?
Correct.
Okay. So I asked everybody, does COVID have them a little bit scared or nervous? Most of them said yes. What about you, Miss Vila?
At this point, no. Honestly, you're just cautious, and more so cautious mode. COVID has affected my life for the last year and a half. So not to say that I'm scared of it. I have very strong spiritual beliefs. I've seen some of the sickest people survive COVID. And I've seen some of the healthiest people not survive. So it's very unpredictable. And I really feel like it's, you know, you can do what you can do as far as vaccines, mask, washing your hands, educating your family. You know, you just see so much.
Mm. So there was something that you said that was key, and I know that you're that we're struggling with your reception to some degree. There was something that you said though when it came to cautious, not necessarily having to be scared. Right now, I know that I've been afraid. I'm dealing with a lot of fear in it. And so what are some things then that someone like me, I've got anxiety, I'm hearing all of this stuff on the news. So it's got some of us terrified. What are some things that you would say to us so that we can quiet some of that fear? What are some practical things we can do?
Just like any illness, you want to educate yourself. And you want to do whatever you can to prevent it, meaning vaccines, wash your hands, keep distance from other people. If you really feel like you're in a health state where you can't be in a situation where you, your life would be at risk if you contracted it. I mean, unfortunately, you have to just quarantine, work from home. Unfortunately, right now, you know, a lot of grandparents need to distance themselves from their grandchildren. It's just really a matter of wearing your mask, wearing an N95 mask, having Lysol in your car, sanitizer everywhere you go, being mindful of when you're in grocery stores, just any public place, any surface that you touch.
So I wanted to, I'm gonna drop one of the questions here for you guys, and I think that that's coming from here. So I'm gonna do this. First of all, has anyone on here had COVID? And if you have, what was your experience? What was it like?
So I think I'll speak up. I'm actually just recovering from COVID, and I probably wouldn't have known that I had COVID because my symptoms were like sinus symptoms, where I had a headache, my nose was burning. I felt like, and it was right around the time, you know, it was real smoky in the air, the fires was coming down. So I probably wouldn't have ever went and got tested. I would have just assumed that it was my sinuses acting up. But I got a phone call that someone that I had been around had tested positive. So I knew then that I needed to go test. But I will say that you do experience a lot of fatigue and a lot of body aches.
Okay.
So it didn't hit me hard. I would have been able to, you know, continue on with my regular routine if I hadn't known. But because I did know, I took a lot of precautions, getting the proper rest that I needed and making sure that I quarantined myself and was eating properly, taking all my vitamins and things of that sort. But I was one of the lucky ones, I would say, because I didn't experience a lot of the severe symptoms.
James, I see you. Let me have you come off of mute, James. I'll take you on mute.
There you go.
There.
Okay, yeah. I too, like her, not too long ago, have come off of it. It's been a few weeks now, but at the same time, when it first was brought to my attention, it was after my godbrother's mom's funeral, and he had went in the next day and got his test results, and they came back positive. My niece called me and told me I was still good. I went and took the test. It came back negative. I went on to work, and then on my way to work, my girl had called me and told me she had tested positive. So I came back and took another test, and it seems like that day that she had said she had tested positive, when I came back that evening is when it all started happening for me. I hadn't recognized that I had lost my taste buds and smell and all that stuff at all. And it was maybe about 2 days later, she came in and she was like, "Did you lose your taste bud and smell?" I'm like, "Nah." And she sprayed a little perfume or whatever the case may be, and I smelled it faint, but I was like, I smelled it. She was like, "No, because this is one of the ones you can smell if I was at the front door and you was in the back room."
Mm.
So that morning when I got up and I took a shower, and I'm using my body wash that I use, and I noticed scent, like soon as you open the top, you can smell it down the hall. I didn't smell anything, and I was like, "Oh damn, I did lose my smell and all that." But like she said, to a twist of it where she said she could have kept on going. Maybe 2 days after that, it was no way in the world I could. It had me. It was a trip because, like I said, I was having the shakes. I was cold as ice, but I was dripping sweat. So it was a whole turnaround and a headache. The eyes hurting tremendously bad. Like, you don't want to, even if you felt like something was in your eye, you don't want to touch your eye or your eyelash. That's how excruciating the pain was. So yeah, it was something different with that. And that happened, that, you know what I mean? That pain and that situation, the fatigue, the tiredness and everything like that, where your mind saying you hungry, but as soon as you got the food right there, but you couldn't even eat, you know what I mean? It was just like, it was just there, you know, and just had to stay hydrated, taking my vitamin C's, doing everything else within that. And then a couple days later, start gradually picking up. And then it was lightweight cool, but yeah, it wasn't nothing I would want on anybody though.
Did anyone else, has anyone else experienced COVID that just wants to share?
So being a healthcare worker in the front lines, there's a high percentage of all ER nurses that have actually contracted it. Me, myself personally, have contracted it last year, July, and I had some of all the worst symptoms. I lost 30 pounds, diarrhea, loss of taste and smell, the no appetite, the fever, developed pneumonia. Thankfully, I was not hospitalized. But yeah, one of the things that I believe your name is James pointed out, and that is very imperative for everyone to acknowledge, is that you can be exposed on day 1 and you will not feel any symptoms until day 4. Right. But yet you are contagious. So that's exactly why this virus spreads so rapidly, is that you don't realize that you're sick and it's too late and you've been around too many people. So that's one of the reasons why we impress upon many folks to wear a mask, even when you're in the presence of your loved ones, especially loved ones that are high risk. I think now more than ever, I think masks are so important because our children and the Delta variant and the fact that our young ones below the age of 12 can't be vaccinated. It's very important that they all wear masks, because at this point, our children are back in school. So essentially, hundreds of families are being exposed to each other through their children. So.
Thank you. I appreciate you sharing that. So the biggest thing that I took away from that then, Vila, is you said that you can be exposed day 1, however, not even know that you have until day 4.
Correct. Many of your physicians, a lot of times, won't even test you until maybe 2 or 3 days after exposure, because they understand, just like in James' case, you can have a false positive.
Okay. And so with so I've got a bunch of questions that are dropping in. Does anyone have any question related to what Ms. Vila just said? So one of the questions that I have here is, does having COVID make you an advocate, or for those of you that have had COVID or have experienced a family member that has had COVID and been exposed to it? And I'm going to ask it one more time. For those of you that have had COVID or have a loved one or a family member that has had COVID, does that make you, or has that made you an advocate for the vaccine? Zonnie, I see you nodding your head.
Yeah. I'm gonna wait for anybody else to answer it first. But yeah, absolutely. I've had maybe about 4 or 5 family members get COVID, and 2 of them end up either in and out of the hospital or just in the hospital for a good minute of time. And just from that and seeing them have to build themselves back up after COVID, and having to do a lot of work to get back to where they were before having it. As soon as the vaccine came out, I was all for it. As far as I'm concerned, I was like, I don't want to go through that myself, or worse, be the person who goes through it but doesn't make it. So yeah, it absolutely made me trust the vaccine, or I mean, not necessarily trust it, but like want to get it and not feel like not let the conspiracy theories like get to me and prevent me from getting that vaccine.
Anyone else? Because you said a word that I'm gonna have to lean into here in a minute. That especially with you young folks. I wouldn't call y'all young, but since I'm a little older than you, is anyone else after just experiencing COVID or seeing a loved one experience, has anyone shifted their mindset as far as the vaccine and been more so for, or more so for the vaccine? James, you had it. Did it change your mind about the vaccine at all?
I'm still real optimistic about the vaccine and everything. There's still a lot of testing going on with it, and what's going on, which one to take, and how it's put out there that right now, so many of the ones that are vaccinated are the ones carrying it the most and passing it on because they not getting sick and not knowing that they sick. Even if they have it, they're passing it on. And then now they coming up with, first it was the one shot to the second shot, and now they talking about the booster shots going to be coming into effect and everything like that. So it's still just me right now. I'm still optimistic with a lot of it. I lean towards getting it because of what I'm doing now. I mean, if I still had my restaurant open, I would have got it just because I'm in a multitude of run through people and all that type of stuff. But right now with my mobile detailing service going on, that's what had me leaning towards needing to get it, because I'm in a lot of people's cars. I'm dealing with a lot of people. So right now, what I've been doing, I just mainly when I show up, I'm still in my mask. I Lysol they car before I get down, and I do it afterwards, and doing it that. I'm just still taking my precautions. But like I said, I've been doing that since the start, and I still ended up getting it. So it's just a hit and a miss right now.
Vila, do you hear that a lot in the field of work that you're in? The questions or concerns James has?
Yeah, absolutely. Many of us are in awe, especially when we take a lot of precautions when we do contract it. So this is just one of those illnesses. I think we are in an advanced time as far as technology, transportation, many different things that the 1918 Spanish flu, our society didn't have to deal with. 1918, they weren't advanced in, social media and transportation and airplanes and, but in the same sense, this is how influenza evolved and how many vaccines and different vaccines had to be developed for influenza. So essentially, if you think about today, COVID is similar to those times, to where influenza changed, the strains changed over time. And as we can see with COVID, it's doing the same thing. So I can understand everyone's, they have their own opinions regarding vaccines and their hesitancies. But in all honesty, being a nurse in the healthcare field for over 20 years, I've always been an advocate for vaccines. I've always received a flu shot. I've never really contracted the flu over the years. So with COVID, yes, some folks prefer to be patient and let the vaccine evolve. Some folks are just taking it as a precaution, you know. Some folks are at risk of death. So, of course, the vaccine would be one of their options. Me being a healthcare worker, I prefer to get the vaccine. After I retrieve the vaccine, I'm then going to vaccinate my children. And that is my personal choice. Everyone's choices are very different. But I think, for me personally, I've seen so much tragedy with COVID. I think the vaccine is definitely a much easier option.
And then with what you just saying that too, though, even with the just with the flu shots going up over the years and everything, I've never taken a flu shot in my life either, and I've never had the flu. Or if I've had the flu, it's been small. I don't know that I had it because, like, on a normal, like I just made 50, but on a normal, I get sick maybe for at the most is 24 hours, and that's every 5, 6, 7 years. I don't get sick, so it's so that, like, right now with that right there, I think that's one thing that had me as nervous and as scared as I was. And I don't even use that word scared because I really don't believe in it. I'm really not scared of nothing, and that's just the truth. But that right there had me really saying some things. Like I talked to my man upstairs, like I said, like literally, like when I was in that pain that one day and really couldn't get out the bed and it had to crawl to the bathroom. My whole thing was, when I looked up at the ceiling, was like, God, out of all the stuff I done did in these streets and everywhere else, don't let me die to this. Don't take me out to this. And that's really what my thought was. That's how painful it was. And that was the most painful day that was. So within that, like I said, and what you saying, and you being in the nurse field and everything like that, I know you've seen it all. But like I said, I've never taken the flu shot. And I think one of the biggest things that stopped me from doing it is because them injecting you with it to see if it fights out. I'm like, nah, I'm good.
It's completely a personal choice, as I said before.
Yeah.
But understand your immunity. I'm not sure if your mother ever gave you the flu shot when you were growing up. I'm pretty sure you got your vaccinations before you went to school.
Oh, yeah, that's fair, yeah.
So at some point in all of our lives, we've actually been vaccinated. But again, it's your personal choice. I think most folks' decision is based on their own personal experience and how COVID has personally impacted you. If you see families wiped out from it, if you've seen children die from it, your opinion regarding the vaccine would change. But again, it's your personal choice.
I have someone here in the chat that asked, how do the symptoms affect those who are vaccinated if they contract it? Are they pretty much the same, or from your experience, Ms. V, or do they change?
Honestly, it varies on that person's health condition. Again, COVID is so unpredictable. We've seen it in some vaccinated folks, their chest x-ray, if they're vaccinated, actually looks more clear than those who are not. So meaning the pneumonia is worse. So there have been found to be some variations in folks that are vaccinated versus not vaccinated. Understand there's different vaccines as well. Our genetic makeup is very different. And in the very beginning of COVID, we heard a lot about genetic makeup and the response to COVID. I know personally in my family, we had the worst symptoms from COVID. And then other families, very subtle, so you really don't know how you personally are going to respond to COVID if you contract it. It's just a very unpredictable virus.
So, Joellen, Nick, I wanted to ask you guys in particular, Aaron, what are some of the things that we're hearing on social media when it comes to COVID and the COVID vaccine?
Man, we be hearing people say like not to take it and stuff like that, and then on the other side, you hear a heck of people saying like you have to take it.
Do they, when you're hearing them say not to take it, what are they saying? What are some of the, I want to know what is some of the craziest theories and conspiracy theories that we are hearing out there as it pertains to COVID?
I got a couple. One in church circles is called, they're calling it the mark of the beast.
Okay.
In very religious circles. Another thing is that supposedly there's like when they do the injection, it's basically like putting a tracking chip in your body for the government to track you down.
Heard that
there's even videos made where like they scan the arm that got vaccinated and then scan the other arm, and a serial number comes up on the arm that got vaccinated.
I've seen that too.
Let's see, another thing I've heard, as far as for those who've taken it and kind of feel comfortable with it. Thank you, AJ. My daughter's having a tea party right now. Sorry. As far as for those who have taken it that actually feel comfortable with taking it, I have heard that like just a safety precaution. That was my thought process on it. But in the same notion, when it comes to like the government with this, is where a lot of to me is where I'm hearing a lot of the hesitation is actually somewhat made me kind of regret my own decision to a degree in getting it. Like I got it to protect my family straight up. Like my mom has COPD. My wife doesn't go out the house too much, and because of that, she didn't really feel the need to go get it because she doesn't go out the house too much. My daughter is 3. I was like, yo, I'm outside all the time. I'm around kids. I do shows. I'm in the public. I'm getting this vaccine because I'm not taking this through my front door and losing my mama, my wife, nor my child. Plain and simple. But when it comes to like how they're tripping about this new variant and like telling people you have to get the vaccine, certain places and cities is saying you got to show your papers for it, right? And yes, I understand in schools they have you get shot records to show that your kids have been vaccinated from certain things. But like you're telling people to basically carry around this COVID, I've taken this COVID vaccine card as if it's like freedom papers. That rubs me the wrong way.
Okay, wait, because you just said a whole bunch. You just said like a whole bunch. So you just said chip in the arm.
Break it down if you got to.
Wait, you see me getting a pencil? I'm getting a notepad because I was like, wait. Okay, so you said that one of the theories is that
it's the mark of the beast.
Did you say a tracking device?
Yeah.
Okay.
Yeah, that's one of the biggest prominent
none of
things.
You have
tracking device.
Other tracking devices on your person, though, right? I just wanted to.
Right, like laptops and cell phones and Apple Watches and all that stuff.
Okay, so one is that it's a tracking device. I could go ham on that, but I'll wait. The other one, the mark of the beast, Pastor Curtis. Pastor Curtis, please come off mute. I don't know. Maybe we have to get. So talk to me about this mark of the beast. Is the mark of the beast the actual vaccine? Is that the theory? Have you heard that, Pastor Curtis?
I haven't. It was interesting. I was going to ask, kind of what are the religious circles that you're hearing that come out of?
These are religious conspiracy theorists, honestly, like not necessarily people who are truly godly people, right, and are moving in their faith. I think these are people who are like.
Well, let's be careful on that because they might be very spiritual and have deep relationship with the God in which they serve. And so I don't want to ding the relationship that they have or their beliefs and practices. I guess I'm just trying to figure out, where is that coming from in regard to the mark of the beast?
I've seen them in a lot of, I guess you would say, like African diaspora spiritual like groups on like Facebook and Instagram. People who are like, I guess you would say, well, like spiritual healers, like people who do tarot cards and stuff like that. Not saying all of them, but like I've heard that in those type of circles because I kind of follow some of those things. But like, yeah, I've definitely heard that. Latoya hopped on and said men from the nation have been saying that. So Nation of Islam, the group that's been saying it's the mark of the beast. My understanding, first of all, up until COVID, I've never heard of the mark of the beast in religious conversation until COVID. So I don't know if they talking the disease is the mark or the vaccine. And what is this mark of the beast?
So Nick, is there anything else conspiracy wise? So we've got the tracking device in the arm, and I've seen a video. I've seen one of the videos where a young lady was like, "Watch this," and she did one arm and it showed some numbers, and then she did the other arm and it didn't show any numbers. That didn't necessarily, cause me to be fearful. And I got the vaccine. I was like, oh, I wonder if we scan my arm, will a number show up? And I mean, it didn't cause me to be fearful simply because, I mean, it's like, oh, okay,
Showing up.
What, James? I'm just saying. But I mean, because they tracking everything that I do.
No, I know. I just said I don't want no numbers showing up.
But at the same time, like if you think about it, you can I know they have it like one way of people like people with prosthetic limbs, like fake hips and different replacement things. They have serial numbers on those metal body parts that they're putting in your body.
Most definitely.
You can scan that.
So the reason why I'm over here is because I'm trying to find out what are some of the things that we are hearing that is creating fear or phobia, that's influencing our decision making. What are we hearing that is influencing our decisions, our ability to make decisions that are in our interest?
I don't even think it's the things that we're truly hearing. I think it's the mixed messaging. Like you can turn on the news, and on one news show, you will hear, get the vaccine. The vaccine will protect you. It's good for you to do this, right? Then the next one, it'll be like you're mandatory to get this, and then the one after that it'll be like, don't get the vaccine or don't do this. You know what I'm saying?
That is what you're hearing, Aaron. That's coming from what you're hearing and what they're saying on there. So that's where you're grabbing it from.
True. So yeah, like it's so much mixed messages that I don't think it's people truly being fearful. I think it's people not really knowing what to do.
The tug of war. That's what it is. The tug of war.
I think it comes down, Tony, to like what we always talk about: who are the trusted messengers in this time? Because basically, you will take the advice of someone. If we got a relationship, James could tell me about some new place to eat, or he could tell me about a restaurant because of my trusting in him. I'll be like, yeah, it must be good. He told me it's good. He's a cook. He says, basically all of this credible, and I trust him because of our relationship. Mm-hmm. Some people don't have personal relationships, but they have sources that they have been trusting, not just through the pandemic, but they have been trusting starting back 2016 when some real division started happening in the political scene. What news that they actually trust and watch? Are they a CNN? Are they a Fox, person? People have loyalties to these sources that they consider their trusted messenger. So it's almost as if we have to find out the statistics on who do you trust? Who are you trusting, and where are you getting? Like you're getting to, where is this coming from? And that's an individual preference, or basically, sorry, getting kind of jumbled. That's an individual choice and preference of who they're listening to that's influencing these decisions that they're making. So it does get confused, but there is a loyalty to this is where I trust the message is coming from this news channel here or this person, because at the same time, there's a lot of messaging coming back on people who are existing in those spaces, contracting, getting it, dying, and those are also coming out. The person who was an anti-vax on Fox, there would be that news story, now dead, from COVID. The person or the person in this religious organization who did not, who condoned it, and they have public messages that they're showing. So again, there's so much going on. It's the individual's preference of choice of who they trust delivering the message. And I think that's why there's conversations that need to be held, because we have an obligation to our circle, of who we are around. When Aaron talks about his family, his mother, his children, there's probably a circle of people he's around that may be discussing. I know with me and my family, we have a group ever since COVID that we do Zoom meetings and everything. And not everybody on there is in agreement, but we have more discussions when we get together about it. Because every time I get found out somebody else has passed, I'm alarmed to hoping that my other younger siblings, or cousins are not in those circles, or I try to go back to revisit the conversations that we're having again, just to see, because my personal belief too is kind of like, Aaron, I don't want to lose another person. And now that it's getting closer and closer and closer these past few weeks, I know the people now. They're here. They're in Stockton. They're my age. They're 30 years old. So now that, as it was this Vila, as you said, as she was saying, when it becomes personal and tangible. But again, even that, I said, no, I want to take up all the time. But that is sometimes not enough, because let's say how many people have we known in our families, African American, that have died from heart disease or diabetes or something like that. Was that enough for us to make a change, knowing that our family has a history of this types of behavior that leads and sometimes causes death, in the end? No, usually not until we've been affected with our own selves and told, and now the diagnosis is in. Now, I know for me that we're making changes, even though I watched my uncle die at 29 of kidney failure. I've watched my grandfather pass, but it wasn't enough to give me a change. So, we don't know where it comes from, or where that decision making comes from. We wish it would be like this, but it has to be the truth. Who do you trust at this time to talk really thoroughly about it and get the information that you need based on your personal body, your history, and all these other facts to make your informed decision and say, you know what, my family doesn't get affected like this. Well, guess what? Mine does. So therefore, my choice is this, because my family, they do. So I was, looking at James, I may be mad at him because he can eat whatever he wants to and then keep that same figure that he has, right? That don't happen for me. Either today I wear it, soon, very much right after, right? So I've got to do something different with my makeup and everything in order, to do for my health. So it's very much, as Vita was saying, the individual decision, but it's like, know you to know your choice.
Right.
What were you going to say, James?
You
came off mute. What were you going to say?
Oh, yeah. No, I was really finna backpack off of Pastor Curtis, but at the same time, and just like in the very beginning, that was one of the biggest things that was said in any space you was in, where you hearing people speaking younger and older. It was like, to the fact, I don't know nobody with it. So they wasn't really taking heed or taking it like it was serious. I don't know nobody that got it. I don't know nobody with this, that, and other, until it got personal and it got close to home. And then the wake up started coming like, oh, damn. So it's that whole little thing to where it's like, just because it's not just like how we are with the concrete team, we are at our situations because we know we come from this concrete. We know what can happen at the drop of a dime, from having a beautiful party to it being a all-out shootout. Who knew it was 22 people inside the party with throwing up balloons that everybody had guns too and was ready for whatever was going on. But at the drop of a dime, if this took place, you was prepared for it because this is the lifestyle that you live, even though you might be the coolest. And that's the same thing. It's like with this, it's not happened directly to me or to my people. I'm not tripping off of it until it finally hits you. Now you fully impact and you worried about everything else. And that was one of the biggest things that was going on. What people were saying on a constant. Oh, I don't know nobody with it. It's not. So they just out there just running wild, doing whatever they want to. I'm not wearing no mask. It's too hot. It's too this. It's too that. If you worked in a warehouse and you had to have and you drive that crane and you had to have your helmet on and that mask working in that thing, you didn't have no problem with it. But it's because these people done told you to put it on. That's where the problem comes from. Mm. It's more of a mental thing than anything else. Mm. Same way where I speak about us doing time in the penitentiary. It's like I done talked to a gang of my folks. Like, man, we done did 5 years together. We worked in the kitchen. We worked in the laundry. We made 6 cents an hour. We made 9 cents an hour. You ain't missed a day in 5 years. You get out here and you won't take a $10 job talking about that ain't, I can't work for $10. You was just with me working for 6 cents. And we made $9.35 a month. We was able to buy 2 cases of noodles, 4 bags of chips, 2 cans of tuna, and some soda to keep it moving. Right. Don't tell me what you can't do or you won't do. That's something that you just don't want to do. Now, to piggyback off of like even off of last night, yes, a difference where you go in there and you fully qualify, like how Elder Tony has spoke on, because we didn't spoke on this before, where you didn't been in this system, you didn't got certified, and you're certified from this place, and get out here. And that place deny you and say that you a felon. But I'm certified through you. I've been working through you for this whole thing. So it's a twist with everything on the belief and a trust, whole little thing on it all.
So the distrust then is coming from the actual, when you guys say they and them, are you referring to the government? Who is they and them?
Yes.
Okay. Yes. Okay. Aaron?
Big yes.
Yes. Okay.
That's definitely yes.
Who is the they and the them? Nick? I see your eyebrows lift up. Who is the they and the them? When you guys are hearing the distrust, who do you not trust? Who is the they and the them? Is it the government?
I was just about to say that. The government, the people in power.
Believe it.
And so, Johnny, I just want to make sure that we across the board, then we're all saying that it's the government, the people in power that are the ones that are not trusted.
And the them and the them are the puppets. The ones that the higher government put out there, just like if you was in the game. You got those that are the ballers that supply to the street. You go do this, you go do that. The government is sitting at the top and they feeding these to speak on and do all this. So that's the them. The government is the they, and the them is the ones that they got out there as puppets.
Okay, so we don't trust the they and the them, and then we also have some internal.
And it doesn't. And I'm gonna be honest. And it doesn't matter who is in power in the they.
Okay.
Because I had my take backs when Trump was still in office, right? And I have some of those same reserves now with Biden in office. Okay. And it's truly because there is mixed messaging across the board. I don't care if it's Republican or Democrat.
Right.
There's mixed messages all the way across the board. So I don't. And just as Sister Vila, is
it Vila or Vila?
It's Vila.
Vila. As Sister Vila stated when I first hopped on the call, like my mom is a medical professional. She's been in nursing all my life. So I've always gotten vaccines. So I trusted to get the vaccine because of my mother's background. Plain and simple. And aside from what I stated earlier. However, if I did not have that in my corner, I probably still would not have the vaccine because there's too many mixed messages coming from both Democrat and Republican. You see Joe Biden talking about wear a mask, and then he's in, or what's her name from New York, the Hispanic lady, that just won. And you see her literally putting her mask back on for a photo op. But 2 seconds before that, she was sitting there in a group of people with no mask on. And you see Republicans do the same thing. So it's like, oh, y'all gonna wear these masks for a photo op, but you're gonna mandate the people to wear the mask, but you're not gonna do and practice this principle the same way you want us to do and practice this principle.
I hear that, and I want to toss it to Chris. I hear what you all are saying, and so I hear that on one side, and then the other side of my brain is saying, so I hear that I don't trust the government. I'm strictly off the iffy on the administration. They're always sending mixed messages. Woo woo woo, and we can historically, I can break a thing down. So I could break it down and preach a whole service on it. But and the other side of my brain is like, and at the same time, I see people catching COVID left and right and dropping like flies in my community now. And I don't mean that in a derogatory way. I'm talking about people are dying. People are dying. People are dying. People are really dying, like they're really dying. So I don't trust the government, and people are really dying. And at some point, then I'm going to have to figure out, where do I weigh out in the midst of all of this? Chris, I'm passing it to you.
I was just going to ask, so where do we get or who do we go to for trusted messengers, right? Like, do you go to the healthcare professionals? We have one here. Or do you go to the pastors? Do you go to the trusted leaders in the community? I guess I'll pose that question to the group is where do we go to get the factual information, whether we're for it or not? Where do we go to get the information that we want to believe for it, I guess?
Just quickly, I would say, for me, Chris, is trusted messengers for me is both medical for me, I'm fortunate to have some medical professionals in my family. So I've got the family connection that brings about the trust, and now I have the medical component that ties in with it, so I can get that piece. Not everybody has that, but for me, that's what it is over the news. That just basically, that is confusing, because it's not, really not Republican or Democrat, because, there's a group that says they're not getting it, who sits on one side. But just an answer to your question, family and medical combined for me.
Sis, I seen you come off of mute.
Yeah, so being in the healthcare field, COVID guidelines, restrictions, new research, a lot of information is fluid. A lot of us expect for the scientists and medical professionals to have the answer. And it's new, it's evolving. The Delta variant is new. So research and studies are still happening. I go to cdc.gov personally. Those of you who know how to look up journals and studies, actual numbers, give you numbers of studies. Those are the things that we as medical professionals have to depend on. We can't depend on Google, Yahoo, news. You know what I mean? These numbers fluctuate. CDC has true numbers. Deaths, they try to trend with nationalities, ages. You want to look at numbers and percentages. You want concrete information. You don't want fluid information. And honestly, if you look at the CDC, and I'm on the Delta variant site as of right now, you'll see different journals cited, resources that they've utilized to document what they have for the public to read and see. So, look into those references and gain your own information. I strongly empower everyone to educate yourself to the best of your ability, because if you look at social media, those are people's personal opinions. And at the end of the day, each of us have our own personal opinion. But you need concrete information. And for some of us, we've experienced COVID personally. For some of us, we've experienced personal death. So again, it comes back down to, what do you know for sure for yourself? Aaron has legitimate, and I am beyond appreciative to hear his reasoning and rationale behind why he made a choice to vaccinate himself. It was in the best interest of his family, not only for himself, but because his daughter can't be vaccinated, because his mother's at risk. You know, those are the kind of things that are impactful. Those are the selfless actions that many of us have to take to protect our communities. And those are the things that we have to do, selfless acts, to honestly get this under control. Many of us will have our own personal opinions about wearing a mask and getting vaccinated, but at the end of the day, this is a community responsibility, because without all of us controlling it, we are going to continue to get sick and we're going to continue to die. Period. So beyond a personal opinion, we have a community responsibility. That's all.
No, that was not all. That was like a mic drop. I'm telling you. I mean, wait. I'm so sorry. Come off of mute.
It's very hard to see children pass away. It's very hard to see preventable situations. You know, it's very hard to see those things. So that's exactly why I'm so passionate about it. I was very reserved about the vaccine myself personally, but beyond my own personal choice, I have to make a selfless act to do what I know is best for my family, myself, and my patients.
You know, so one of the things that I try to do, I govern myself by a principle in all my get understanding. And I really try to, and I appreciate you, Vila, saying that, because at the end of the day, we're the only ones that can make a decision that is for our best interest. And we should not be judged nor condemned for the decision, the thoughtful decision that we make based on our own circumstances, our own situations. None of us should. And we shouldn't hold and judge others. We do need to then look at, and I guess I want to kind of land in this area here. When we make a decision, then that is not a communal decision, where others might be then in jeopardy. So I'm not sure whether or not I'm vulnerable, but I know I come in contact with my father, with my mother, and I know that they are vulnerable. So I have to then, you know, be very, very careful. And so I did. I went ahead and I got the vaccine. And let me go ahead and put it out there. I'm not pro-vaccine. So I don't do flu shots. I don't do none of that stuff. And so let the record go ahead and stand for anyone that doesn't know that about me. I don't do it. My children can let you know I don't. So I've only had 2 flu shots in my life. And both of them were to be there during the birth of my grandchildren. Other than that, I wouldn't have did it, sis. Vila, so I would not have done it. But I went ahead and I got this. I got the vaccine. And in our focus group today, I got the vaccine and I waited to see. I was looking at some rich white folks to see, you know, some rich white folks I knew. And I was monitoring them to see, you know, how I was going waver with them. That's how untrusting I am about a thing. Pastor Curtis is laughing because he knows the truth. But I went ahead, I put on my big girl drawers and I went out there and I got the shot. And I went back and I got the second shot. And I was like, okay, let's see. I was nervous. I was all of that. But I did it because it's what I felt that I needed to do. And I felt it was in the best interest of me as a community leader, as someone that goes in and out of spaces with vulnerable folks. You know, so that's why I did it. But I made my choice based on research and based on my own personal, you know, decisions and choice and information. And I believe others can do that as well. So how do you build? I want us to be able to respond to some of the questions that are in there. One of the questions, Vila, that is here is, how do you build an overactive immune system? If it's not something that you feel comfortable with responding to, you know, I'll just keep moving in that.
Honestly, I think Ms. Davis spoke on it earlier when she expressed when she was sick, taking her vitamins, exercise, and staying hydrated. Everything that we need to do as far as staying healthy. vitamin C. You know, there's different things out there to build your immunity system. There's very specific organic things you can do to build your immune system. Aside from COVID, understand there's situations and circumstances that actually reduce your immune system's ability to fight diseases. That's stress, lack of sleep, lack of proper nutrition. These are things that we already know. So just leading a healthy lifestyle would actually help you prevent from getting sick, getting sleep, taking all your multivitamins, eating healthy, exercising as recommended by our healthcare field. So, you know, we all have the information to stay healthy. It's just a matter of our life factors allowing us time and finances to do it.
Ooh. Can we just make sure we get on that for a second? Because that's the truth of the matter. I've seen kids catch it, like teenagers catch it. And when I think about students that I've had that caught it, what pains me the most is that they don't have the financial ability to fight it. There's one thing that I've used to boost my immune system, and that's drinking things like Japa juice, right? Which has sea moss in it and all types of other healthy things in it. And it really builds you up. The vitamin C, drinking my orange juice regularly, right? But I've had the agency to do so by the grace of God, because I wouldn't. This had it happen 3 years ago, I probably would caught it and been struggling, right? But we do really need to sit on that. We talk about COVID in the Black community. Like, let's be real, especially in Stockton. Our city essentially is a food desert. And our people are workaholics. Half of the people in the city of Stockton have to commute more than 30 minutes just to get to work.
Absolutely.
You add that time to your work day, people ain't sleeping. People not able to exercise in a way where they're able to be physically fit and fight these diseases. So like let's be real and sit in that. And like bring that to the table if we're gonna really talk about how we as a community fight COVID in our communities.
So one of the things, what you're saying, Aaron, is true, and that is also one of the reasons why we believe that it is hitting the Black community in such a heavy way. But I'm not a professional in that. I'm a community organizer that has advocated fiercely for that, and I'm sure public health advocacy has too. But Vila, is that one of the contributing factors to some of the health disparities that we see in the Black community surrounding combating COVID?
I would just say all diseases in general, not only COVID. Social determinants of health is what I reference it as, because it encompasses all of that, from health to finances to access to healthcare, access to grocery stores in our neighborhoods. Social determinants of health references all those things. That is a huge topic. That is something that, you know, I taught this in Sacramento County, more so to foster children. But I think social determinants of health needs to be discussed in our schools today because it's such a big deal. I 100% agree with Aaron. It doesn't just attribute to COVID, though. It's our heart disease, our diabetes, you know, all these different things. Social determinants of health is directly correlated to our health disparities.
So Chris, I seen you go off the camera, but I wanted to make room for you or Mary, Pastor Curtis, Zani, if you guys had any final questions that you guys wanted to lift up.
You know, one of my questions was actually for Aaron when he was speaking on some of the misinformation that's out there. Do you think it's because the virus is so new and CDC and our scientists are still learning about it, still trying to figure it out? Or do you think that they and them are intentionally putting out these, I guess,
Yeah, I got you.
Yeah.
So I think just like a lot of situations in in our government, COVID is being used as a tool to pit people against each other. Plain and simple. From the vaccine to the disease. And because we live in this dual political system, it's very easy to do so. There's always confusion when people do not move on one accord. That's why it's in the Bible that God loves us when we move on one accord as a people. He blesses those who 2 and 3 in the space. I'm probably misquoting. Anyway, but truth of the matter is, because we're not moving on one accord as a people, we cannot fight this disease the way we should be able to do so. Because of the level of politics in this.
So does that go back then to what Ms. Vila lifted up in regard to approaching it, in a sense like a community, and then, just not just making choices or decisions based on my own personal interest alone, but making choices for the community in which I am a part of as well, like village decisions.
Yes, village decisions matter. Like, I saw somebody say, like, in the comments saying that basically it's being selfish if you choose not to get the vaccine.
It was a question.
It was a question, right?
Question.
And to answer that question, brother, not particularly. Yes, it can be looked at as selfish, but if you look at the village decision as a whole to say, hey, we can fight this disease and let's take all the necessary steps as a community to do so. I guarantee you, and it's not just for COVID. This can deal with homelessness. This can deal with lack of education levels in our schools, in our city. This can go to reducing gang violence and stuff like that. This goes across the board. When you move as a community to address a problem in your community and not be selfish in it and say, what are the true needs of my community? That's how you fight these issues. And COVID is one of them.
So, Pastor Curtis, if you had the opportunity to ask for help from your community, for you and your family, what would you need from your community? What would you need to help combat this thing with COVID from your village?
I think it's what we're doing right here, right now. I would need basically just genuine conversations and relationship. Sounds kind of simple, but actually it really isn't. We're very disconnected in so many ways. So that's why we're usually not there for each other, except for just kind of me and mine. So even if we talk about the conversation about, if it's selfish or not, is that we have been in some way, I said, almost indoctrinated into that way of mind and take care of mind. So I would need to know, basically, I would need relationships with the community so that they become, we start to trust each other in this. And basically, it's kind of, I think about when I was in New York, I went on a tour of the Underground Railroad, and there was this one place that they marked off that used to be the watering hole. It was the watering hole where the people the actual women who were in the house would hear the conversations happening in the big house, and they would come there, and that's where they would meet and converse, and that's how the word would get back out to the rest of the slaves that weren't getting the messages, and that's how they would come into the one message, the one accord that Aaron is talking about. And it's kind of the spirit of that. And what you're doing here is, how do we create those spaces of community and trust and conversation so that we can talk this through? What's best for us? When I think about that, that conversation is also because I think about the division that Aaron is talking about, and I'm like, it really kind of almost doesn't. When I say doesn't make sense, I'm talking about the type of division, because we have one group over here that is the far, the Republican. I should just say the Republican, that says we're not taking it, And then they're also saying that we're going to take funding. And this is a source. We're going to take federal funding away from schools that are having mandated mask, protocols. So and then we're going to provide scholarships for parents who will withdraw their students from those schools, and we'll give them scholarships to private education schools. And so you have that group right there saying no to vaccination, no to mask. And then you have a portion of our community saying the same thing because of these conspiracies, where they're actually agreeing on the action, right? They're not agreeing on how they came to the actual decision, but they're agreeing on the same actions, but they disagree in so many other things, in so many ways of life. They disagree on, do our lives matter? They disagree, and everything. But it's like these two groups are agreeing on this level here. And what is that about? It's about us not coming together, as Aaron says. It's about us not having our agenda, basically our narrative, which is the true narrative of us, our people, and where we fit in with what's going on with COVID. What are the systemic issues? Why we're targeted? Why there's a target on us because of our health disparities, because of the neighborhoods that we live in, because of our lack of resources and access and things like that. And so if we can get into more conversations like that, where the village elders come in and we hear from the elders, and then we hear from the young, and we have the visions, the dreams, all of those components that make up the whole total picture. That's what I would need, those relationships, so that I can be like, we don't have to come, we can disagree, but we don't have to argue, and we don't have to fall out. We don't have to discontinue fellowship because we disagree.
Right.
We walk and we work it out together, because at the end of the day, I want you to be alive.
Yeah.
Right.
I want to piggyback off that for sure. That's what I was going to say too. I think that it really is, we have to be cognizant not to diss or just push away or anything like that towards people who don't want to get it. Right. Mm-hmm. That's a personal choice. You know what I mean? I got mine, and that was my personal choice. Right. But that doesn't mean I want to, diss anybody who doesn't want to get it. Mm-hmm. And I think until we get to that level of understanding that, we all have our choices, and, get it once you feel ready to get it, right, and you're more informed, until we get to that point, I don't know if we'll ever, I don't know when this division will stop. But I think it is based on the relationship building that we need to have for sure. Because, we shouldn't scorn the people who haven't gotten a shot for sure.
Right.
Over time, proper education and stuff like that will either help them get it or they won't get it. But, all we're here to do is just properly educate on the facts of it. And that's it.
Vida?
I just want to make a real quick comment. The question that was in the chat is, does someone that does not get the vaccine seem selfish? When I reference community responsibility, one, vaccination is one part of it, but other than that, wearing a mask to protect others from you, knowing that you're not vaccinated. So I'm not saying that everyone has to be vaccinated, but we all take our own personal responsibility in making sure that we don't spread it. If you don't feel well, stay in the house. If you know your child doesn't feel well, keep them at home. There's many different forms of responsibility. Keeping your hands clean and washed. Not touching other people's food if you know your hands aren't clean and washed. Mm-hmm. There's several different forms of responsibility when it comes to transmitting disease versus just a vaccine. I just want to clarify that.
No, and I appreciate that, because that's still village, that's still community, and that's still us taking ownership and responsibility for one another. That my brother Ansar, he was sharing. So he has different herbs and different things that he practices and that he provides, and that is how he takes care of himself, and that's how he takes care of his loved ones. And provides access to those things. And so should he be scorned? Should he be, ostracized? Should he be looked down upon? Because that is what he does and how he practices health and wellness and self-care. And so when Aaron said that we're being pitted against one another, That right there is huge. That's taking place in our communities. We are, and that's where this type of space, this conversation, it's got to take place. It's got to be important. I need to love Pastor Curtis enough to make sure I'm wearing a mask when I come around him, and when I come around others. If I'm not feeling well, I'm going to put on a mask. I'm seeing folks, hold up the sign, my body, my rights, all of that different stuff. It is your body. It is your rights. However, I'm also going in grocery stores where I see people that, you are visibly ill, coughing, spewing. I've had some folks that, James, that have full-blown COVID get up and go to the grocery store. I've heard horrible stories of people that have COVID, tested positive, body aching, and you scheduled a massage. Come on now. Do you not care about the person that you have to go in and they have to massage your body? What about her or him? What about their family and their loved ones? Do you not, and so for me, that's where my heart aches. That's where my concern is. You ain't got to get the vaccine. Just, man, can you care about the life and the livelihood of those that you are coming in contact with? So I wanted to just kind of give everybody just 1 or 2 minutes. If you have any final things that you wanted to say, so that we can wrap up conversation.
Yeah, just to piggyback off your last point. And a point that Sister Gaines made in the Facebook chat. I love you if you get the vaccine or not. All I ask is that you practice your civic duty and village responsibility and watch yourself and realize what your body is doing. If you are sick, stay home. It's okay. We actually got resources now where we can stay home and still get something to eat. Right? And if you are able-bodied and you're out here, when you are in these big public spaces, even though you might not have it, mask up, use the sanitizer. Just be clean. They said that from day one. Be clean. And if you at home and you realize your house a little junky, clean up. That helps. That's all I gotta say. Be responsible. Don't take much.
They shouldn't even have to tell nobody to clean up and wash their hands. It should been something already doing. And the people that got mad about people telling them to wash their hands was ones that don't wash their hands, coming out of the bathroom, doing everything else. How you get mad at that? That should be something to just go over your head. That's crazy.
Zonnie? Now we got James all upset about dirty hands.
Yeah, for real. Hey, Chris, don't be laughing at me, man.
You already know. Some of us got some pet peeves.
It's all good, man. Yeah, wash your hands, man. I feel you. Yeah.
For real. People's getting mad, but that should be over your head. You should already do it. That shouldn't even register to you.
Right.
I don't know. I just be having the issues when I see folks like, okay, they just asked you to wear a mask and you standing up on the Capitol steps talking about my body, my rights, and you the same person that's protesting about somebody going to get an abortion. Oh, yeah. I'm sorry.
You probably went in the bathroom, used the bathroom, and didn't wash your hands when you came out.
You got pro-choice to wear a mask, but then this yeah, I'm so confused. And so yeah. Zonnie?
Just one final thought that I'm having one thing that stuck with me from this conversation for sure was talking about how our community doesn't trust the government, and that's leading to a lot of our community like not wanting to get the vaccine. And there's definitely a history with like Black people and healthcare and not being heard or not being taken serious, or even like going back to the Tuskegee syphilis experiment. Black people have been done wrong by our country when it comes to healthcare. So it's understanding that there's a little bit of pushback, and it's understanding that there's hesitancy. But like this conversation and more that we need to have in the future, we need to do the work to push past that in order to secure the health of our community.
Yeah.
I'll chime in for my final thoughts. I think conversations like this are extremely helpful, right? Because even if you're not going to get vaccinated, you have people in the chat like Zara talking about herbs and stuff like that. So you're able to learn other ways to help fight off, a weak immune system, right? To build your immune system. So these conversations are helping to either people will get it or people won't, but you could find a way to still stay healthy. So these conversations, I think, is extremely powerful. And need to be continued around this topic, and it will bring people together instead of continuing to divide the people. So we don't have that war that vax versus unvax. That's not necessary right now.
Mary?
I'm just gonna basically piggyback off of my sis Vila. If you choose not to vaccinate, take care of yourself. Make sure you're taking your vitamins, exercise, stay masked up, and social distance at all times. If you are vaccinated, thank you. Thank you for taking the initiative to be a community servant. Make sure that you are doing your part and protecting yourself and protecting those that you love and those that are around you.
Was that everybody? Yes. Can I also say, in addition to the thank you that Mary just lifted up for those that did get vaccinated, can I also say thank you to those that choose not to, but are still practicing self-care and loving me when you're coming out? I want to say thank you. Can I just say thank you to my community? Can I say thank you to Ansar for loving us enough to provide alternatives? You know what I'm saying? Because he's trying to make sure that we're informed for those that don't trust, because there are those that don't even get their children vaccinated, for school or what have you. And so before there were vaccines, there was village and there was ways in our villages and our community. So I want to thank those that are in our community that do care. And they care, and they're showing it, and they're unique in their different ways. And so I just wanted to lift that up and lift them up. I see you guys. I love you guys. I appreciate you guys. And I also, just kind of from a maternal side, if you know you got COVID, if you know that you have been exposed, don't go grocery shopping. Don't go get no massage. Can you not go to my nail technician? Right? Because Chris, come on, I'm being a little selfish, but I'm being serious too.
For real.
That ain't selfish, that's real. Because your technician is somebody else's technician, my barber somebody else's barber. Like, we all don't do these things ourselves. You feel me?
Elder Tony, I wanted to shout out Enzar as well, because I did pick up some Joppa juice. Thank you so much. It was actually really good, and he delivered as well. So shout out to Enzar and Joppa juice.
And it helps.
Sorry, we just love it on you. I ain't had none of the
Joppa juice too, please.
What you say, Vila?
Can I get some Joppa juice?
Yep, go to the website. I'm telling you, it works.
Absolutely.
Put the link in the chat, you guys.
Ansar, can you put the link in the chat for us so that we know how to access your product?
One thing I do want to put out there, I cannot express enough for all the essential workers. Healthcare workers are not the only essential workers. The only way we could get through this pandemic is our teachers teaching from home, folks that did Instacart, folks that did DoorDash. The variations of positions that people played in this pandemic is the only thing that got us through it. It's not only but pray for our community, pray for the world. This is just the beginning of what I feel is to come. Healthcare is forever changed from this. I don't feel that in healthcare we will ever not wear masks. So And I don't have a problem with it because it's to protect our patients and protect ourselves and protect our family. But keep that in mind. Teach your children how important it is for them to protect their grandparents and to protect each other. The only way to control, I feel like, to control transmission is to teach. Continuously teach and hold each other accountable. If you notice someone is going to they touch their mouth or sneeze and they're going to touch something, please don't hesitate to stop them. Because if they feel disrespected, then that's a problem. But if they appreciate you, letting them know, then that's the beginning of changing of a habit or a bad behavior.
And Vila, let me just say thank you for being one of our frontline workers. She's been working throughout the entire pandemic. So we appreciate you. Thank you.
Yeah, thank you for sure. Thank you a lot.
Yeah, and so I mean, and I know, and I don't know personally, but I know that that you got COVID, it impacted you, and then you turned around and you went back out there, and you got right back on the front line, and that's the mark of a true soldier and a true warrior. And so I absolutely respect and appreciate you and the love that you speak from, Vila, because you really do. You speak to us from a place of love and care. And so I really, really appreciate you for being in this space today. All right, loved ones. So I appreciate all of y'all that tapped in this evening for this conversation. And so here's the thing, at the end of the day, we got to talk about this. We got to have these COVID conversations. We need to talk to our families and stuff. Like Vila said, right? We need to be teaching just some practical things, but we can't be afraid to have comfortable and uncomfortable conversations. Because at the end of the day, the only reason we arguing about a thing is because we all care, right? When you fight about how to take care of a child, it's because you love that child. You just have two different approaches to it, but you love that baby, you love that child. So now we love each other. It's very rare that you have somebody within our community of color that we don't love. We love each other. We just have different approaches to a thing. So let's sit down at the table. Like Pastor Curtis said, the elders come together, and put some things together. Listen to our youth and young adults. Hear them. Listen to what it is that they have to say. Don't just kick them to the curb and act like they don't bring wisdom to the table. Let them teach you. Be pliable, elders. So we got some work to do in our community because don't nobody love us like we love each other. Now, on that one, I'm going to say amen. So if you don't get your shot, if you choose not to get the vaccine, can you wear a mask? And if you know you got the vid, can you not give it to me? I don't want it.
Don't want it.
I don't want it.
You just gave it a new little turn.
No,
that vid.
We've been calling it the vid since it came out.
That's what y'all call it?
Yeah, we call it that.
Wait, y'all was calling it the vid in what, 2019?
Yeah. It was either called the 19 or the vid. That's it. That's all.
Right? It was a middle schooler who called it that. I was like,
we don't want the vid.
We don't want it.
Stay away from that 19, man.
All right, y'all. So peace out. Everybody just wave,
Bye, guys. Thank you for joining.